Mayors?
The mayors. Yeah, mayors. And then we're gonna end with I want to say congressional. Yeah, don't worry. We're interviewing everybody, okay?
Yeah.
So your God's is coming up here, or your Henny. 9:20. We'll go to the K-Wave News Zoom room where it's all incumbents. This morning we have the Speaker of the Guam Legislature, Democrat Senator Speaker Tina Munya Barnes. Good morning, Speaker.
Manana si Zeus, Chris and Sabrina, and Manana si Zeus to Guam.
We also have a Democrat incumbent, Senator Amanda Shelton. Good morning, Senator.
Day, everybody. Good morning, Guam.
And then on the Republican side, we have incumbent Senator Mary Camacho Torres. Good morning, Senator.
Good morning, Hafaday, Chris and Sabrina. Hafaday, Guam.
And we'll go ahead and just let you guys know the format is you get a 1-minute opening statement, and then Sabrina and I will ask questions. Each question, you have a 2-minute response time, and then we'll give you a 2-minute closing statement. Now, we're being really firm on the time. Sorry, don't take it personal if I cut you off. Somehow I got stuck with the job of being the moderator. So it's 9:20, and we'll go ahead and start with your opening statement. So, Speaker Barnes, you have 1 minute to address the people of Guam with your opening statement, and that 1 minute starts now.
Thank you, Chris and Sabrina. My name is Tina Maria Barnes. I'm number 5 on the Democrat side of the ballot. I've been your public servant for 7 terms. I've worked in the government for almost 4 decades. It is in my heart to continue to serve. My job is not done here. I want to continue to work on automation. I want to continue to bring new industries in, and I want to advance the opportunities for our younger generation to lead in this very near future. I created the Public Policy Institute, and I want to expound on that. So I have a lot of hard work. I'm a great facilitator, and I'm number 5 on the Democrat side. Please, I humbly ask that you consider me. Jesus Masi.
Thank you, Speaker. Senator Shelton, your 1 minute opening statement begins now.
Day, my name is Amanda Shelton, and it has been my honor to serve as your senator in the 35th Guam Legislature. This term, I have worked to help our people by protecting our manamku, by providing opportunities for our youth, by preserving our environment and promoting health and safety for our entire community. And I know our world has been turned upside down, and I want to continue to serve to help our people as we navigate on the road to recovery together. I'm number 6 on the Democrat side of the ballot. I'm Amanda Shelton, and I humbly ask for one of your votes.
Thank you, Senator Shelton. Senator Torres, your 1 minute opening statement starts now.
Hafaday, good morning, everyone. My name is Mary Camacho Torres, and I'm a candidate for re-election on the Republican side of the ballot. I'm running because we need policies that rebuild Guam's families and remove barriers to opportunity, that restore dignity to our island. Like many of you, I too have raised a family and worry every day about the choices that leaders make, that it directly impacts our children and our grandchildren, and especially our most vulnerable in the community. And I believe, we deserve good leadership. I offer just that. And I want to also thank the people for allowing me the opportunity to serve as long as I have. I am grateful that you've given me your trust for the past 6 years, and every day I've worked to keep that trust. Again, I'm Mary Camacho Torres. I'm number 5 on the Republican side of the ballot, and I humbly ask for your support. Situs Maasi.
Thank you, Senator. Bree, first question.
Many people have said there's been a lack of compassion in the government's response to COVID. And I'm talking about, for example, people that are quarantined over at the government quarantine facility who've wanted exemptions, right, to attend funerals, and it's never been an easy process for them. And then you talk about people that have family members that are non-COVID. This is the story of Galen Cruz, that she's hoping that there will be this caregivers program. But for majority of people are saying that, there's just this lack of compassion when decisions are being made. And I'd like to see what your thoughts are on, do you also feel that there's been a lack of compassion, or do you think, these are the hard decisions that have to be made? as we deal with this crisis. And we'll start with you, Senator Mary Torres. You have 2 minutes.
Thank you. The thing about our island is we are noted for being a compassionate people, a caring community. So certainly, one of the things that I recall in listening to the physicians advisory group when they were talking about COVID is that one of the greatest travesties of this COVID pandemic is that it leaves us with a very undignified death. Undignified in that oftentimes you die alone, or you die in the merciful arms of a nurse who, gives you that little bit of compassion. So certainly I think we need to have protocols that allow for us to at least in our custom tend to our dying, tend to our ill, and come to grips with it. Because after all, the dead will leave us, but the impact and the hurt that they leave to those that are surviving them is great, and we can't be insensitive to that. I think what's also important, though, is that we have protocols that are very clear, clear to people who are arriving in Guam that may need to seek exemptions. I think that you talk about communication, and that is precisely what we need, is greater communication so that everybody is clear about what is it that is expected when you come to Guam. What is it that is required of you? What are the protocols when you want to get an exemption to quarantine? But I think also we have to have a little more gray area when it comes to quarantine too, in terms of if you're a resident and you can sufficiently quarantine at home, you should be allowed. But first and foremost, as Governor Gutierrez, he's a hard act to follow. But he certainly spoke to that you can't have rigid rules, that there's always gray area, but mostly you have to allow people to tend to their loved ones. Absolutely, and without question.
Thank you, Senator.
Thank you.
Next question. What letter?
Speaker Barnes?
Oh, Speaker Barnes. I'm sorry, Speaker. I thought you went first. My bad. Speaker Barnes, you have 2 minutes to respond.
Yes, I just want to share with you that just over the weekend and this past week that I've had to help assist in 4 families trying to seek that relief, that hardship, so that they could be with family. And one family had shared with me that they had to decide that they'd rather that their mom stay at home and die at home, because if they were sent to the hospital, the predicament was that they had to, that she would go by herself. And I think Governor Gutierrez was right in saying that, and I share the same sentiments with Senator Torres, that there are protocols in place and we should follow it. But every case should be looked at in a different perspective. And it's what can we work with to help the family ease that emotional pain and those struggles that are going to. So as I hear the stories and they continue to come, it's how do we facilitate that with the protocols that we have in place? How much more can we be compassionate, and what gray areas that we can work with to adhere to the pleas of the family? And communication is everything. We're all in this together. We don't have a playbook on how to deal with it, but it is our culture to be more compassionate to the needs of the family. So I think in this area, it's how do we work closely with the family to give that last wish to help the families bring that time together at that last moment in time before that loved one leaves this earth. So communication, because a lot of the protocols are already in place, is how do we follow through and facilitate? Thank you, Bree.
Thank you.
Thank you, Speaker. Next question.
Senator Amanda Shelton.
Oh, did she? Okay, Senator
You
Shelton.
have 2 minutes.
Oh my God, sorry, Senator Shelton, you have 2 minutes now. That's why I'm just moderating.
No problem. Thank you. You must be really excited for that next question.
It's my favorite one.
I think one of the biggest blessings that we can have as families, as Chamorro people, island people, is taking care of our loved ones. It's really something that we see as a blessing, whether we have an aging parent or grandparent, or taking care of someone who's sick. And serving as a caregiver really gives you that kind of special time together to share those moments. And it's a very, very strong bonding moment. And I understand that it's hard for people right now. And that's the hardest thing that a family can go through, is losing someone and not being there to care for one another. And I also understand that we have protocols that are in place to keep us safe and to stop the spread of the virus in our community. But there's definitely room for compassion, and there's room for exceptions. And just like the speaker, our office has facilitated many requests to ask for a hardship exemption from the government quarantine, and to go home earlier, to be with their families for the rosary, to see their families in the hospital, to be there at the funeral. And it's the most difficult, heart-wrenching kind of request to have to fill right now, and to be there to help our people get through it. And it's natural for us to want to be there in the hospitals by their bedside. And so as we learn more about the virus, about the protocols that can keep us safe, that can protect us, as things evolve, I think there is room for us to move quickly along with this new information and allow for some exceptions.
Thank you, Chris.
Oh, I forgot the
You
question.
can ask your question now.
Is it okay now? You sure? Everybody's done?
Yeah,
Okay, so again, what letter grade, A through F, would you give the Leon Guerrero Tenorio administration's handling of the pandemic, and why? We'll go ahead and start with Senator Torres. You have 2 minutes to respond to the question starting now.
I think, in all fairness, if C is an average letter, then it would probably be a C, a middle of the road. What we have to understand is that the governor is dealing with something that is an unprecedented health emergency. And she's also relying on a lot of the practices that are being done across the nation and the world. And, clearly there are things that we can do better. Hindsight is always 20/20. But given that you don't, her first and foremost concern was how to curb a health crisis and overreaction and I'm thinking about the hospital. We didn't want to inundate our hospital to the point where we couldn't take care of our ill. And I think that was a valid concern of hers, is to make sure that people who present themselves to the hospital can be seen. But I think first and foremost, we have to be realistic about how this is not an only on Guam situation. A lot of the struggles that she's going through are the same struggles that other governors across the nation are going through. Unfortunately, we don't, what's also happening across the nation and across the world is that the public trust is corroding as this corona burnout happens. And so it's just human nature. We're tired of being locked down. We're tired of having our so-called liberties taken away, and we're fearful of the unknown. So I would say she is probably performing on average, as is every other governor dealing with something that's so unprecedented, and there's no tried and true answer. So I would just have to give her that.
Thank you.
Thank you, Senator. Senator Shelton, you have 2 minutes to respond to the question starting now.
Thank you. I think there's definitely room for improvement for all of us. I think the administration has done the best they can with the information, with the data that we've had on hand. And we know that she has the experts from public health, the physicians advisory committee, and those surrounding her to give her the best possible advice to make decisions that are the best for the island. There's definitely room for improvement when it comes to communication, when it comes to messaging. We can see that people are frustrated. Our community is suffering, and we want to get out of this state. We want to return to normal when we know there's really no normal to return to in sight. But the messaging can definitely be better to remind the people how serious this is. Well, what we're going through is affecting all of us. And really the motivation, I think, for everything that has been done so far has been to give our community a fighting chance. And so I appreciate what the administration has done to keep our community as safe as possible, to keep people out of the hospital, and to stop the spread of the virus.
Thank you, Senator. Speaker Barnes, you have 2 minutes to respond to the question starting now.
Thank you, Chris. As I shared the same similarities with both senators in this Zoom, I want to take it from an approach, from a two-prong approach, from the health component and the economy component. As we relate to the health, when we first had this pandemic, the administration worked really hard to put all these protocols in place, right? And things were going okay. But then the communication, giving information out to the community was probably needs to be more accessible. The hotline, especially in the last four constituent cases that we've dealt with, the communication and just getting an answer from the government on where to go was really, literally difficult from that hotline perspective. So we can always improve on that. So that on the health component, then we would have to give it maybe even a B. On the economic component, it depends on who you talk to. If you're talking to some of the business stakeholders, they'd say this administration flunked because they're not opening up. But how do you take that when we have a fiduciary duty to make sure that our community is safe, to make sure that nobody else tries to get sick or dies on us? So do you choose business or do you choose life? And if you come from the perspective of life, then you know that we can make sure that we try and follow the guidelines, but also know that we've tried as a legislature to put out sanctions for those who violate, and that wasn't accepted. And now the business community is coming back up to us and saying, well, you need to put these sanctions in place. So as working with the economic committee,
Thank you, Speaker.
I give them back.
Thank you, Speaker.
There's a lot of anxiety out here in the community. Suicides have gone up. What will you do if reelected to improve mental health services on our island? And we'll start with you, Speaker Barnes.
Thank you. I've introduced Bill 400 to give the resources that it needs to both public health, mental health, and all that. But I must say that the Public Policy Institute and the cohorts interns who worked with us over the summer shared legislation to give mental health the resources for suicide. I don't know if you guys know that the suicide rates here on Guam have increased, and it's really hard, tremendously. We went from barely 5 to 15, and it's a hard realization that suicide is prevalent here on Guam. We're ranked the highest per capita, but these interns were able to look at this issue and saying, we need to get that resources. How do we look for those resources? Get the special funds as it relates to from the Healthy Future funds, work closely with mental health to see what federal grants are out there, and then work with this issue that is literally hurting our community right now, suicide. With everything that's going on, there's a lot of folks that are giving up. And we have to be open to listen to their concerns, but more importantly, we have to look at the different perspectives. And suicide prevention with the interns was very, very key to them and giving them the resources. So there is already a bill there that is being introduced, and the draft is done, and we're working with mental health right now to see how we can move forward with that. And I just want to say thank you for them, because they did appear on your show, and we want to move forward on that bill for them.
Thank you. Senator Shelton?
Well, in this term, I was really proud to support the mental health first aid bill to give funds to the Department of Behavioral Health and Services to train people to respond as first aid responders for people in crisis, to respond to concerns of suicide in our community. And there have actually been, I think, a total of 16 new trained young people in our community just in the past couple of weeks to respond to this crisis. And I will continue to support the department and our other agencies who answer the mental health needs of our community. As a senator in the next term, I'm really thankful also to DOE. In our last roundtable hearing, we heard about how they are allocating a lot of their CARES Act funds to help reach the students and ensure that their mental health is okay at this time, the students as well as the teachers, because we're all going through changes, adapting to this new way of life. And of course, that kind of change is hard for our young people. And I encourage everyone in our community right now to take the time, even though we're physically distant, to lean on one another, to check in on each other, to take the time to text each other, give each other a call, because we don't know how long that kind of little check-in, how far that kind of check-in can go, and knowing that we're still here for each other even though we're far apart.
Thank you, Senator Torres.
I've always considered mental health and substance abuse as tied in together. A lot of the mental health, the people that are mentally ill also have substance abuse issues. I found in a lot of the dealings that I've had with officials. And so a lot of the legislation that I've had, centers around how do we combat substance abuse? How do we close the revolving door of crime? How do we help people reintegrate into society? Because a lot of the self-worth of people is their ability to support themselves, to live independently, and to build up their self-worth that way. But one of the things that I've been working on for over a year now with the Department of Behavioral Health is how to develop a program that allows families to help those family members who don't either recognize they have a problem or don't want to seek help themselves, by committing themselves. Because there are certain types of programs where you can present someone for evaluation and for treatment, not necessarily against their will, but it's one more tier. So I think that what we have to do really is just not only work with people who have issues, and a lot of it is substance abuse, curbing the drug problem on Guam, but also working with the court system so that people who've had issues can, reintegrate into the community. And then the third part would be to work with families to help their family members get the treatment. Right now, we also need to open up the treatment centers right now during COVID. It's having a bad impact on people who are relapsing.
Yeah.
Thank you,
That's a
Senator.
big issue.
Our next question, it actually comes from one of our viewers. What are you going to do, excuse me, for those who are now unemployed and have no health insurance, who cannot afford the COBRA insurance rates, but do not qualify for Medicare? We'll start with you, Senator Shelton.
Thank you. Yes, I know that this is a big concern for many in our community who have lost their job, and ensuring that we have a continuation of healthcare. And I think that we can address this in the legislature by providing a way forward for universal healthcare for all the people of our island, regardless of income, regardless of employment. And I will work towards that. And I've also worked in this term to get our people back to work by providing an additional $1 million to the Guam Community College Apprenticeship internship program to provide training to another 250 individuals in job markets on Guam that are that need to fill employment, such as truck driving, ship repair, IT work, paramedics, and this is a program. These are programs that people can sign up for and be trained and skilled up to build up our local workforce and get back to work.
Thank you. Senator Torres.
I believe that one of the most practical ways to have access to healthcare is by providing more nurses on Guam. You know, nurses that can help be staffed at public health, advanced practice registered nurses who now, you know, because of a law that I authored and was signed into law, have full practice authority to their training and oftentimes fill the gaps when there aren't enough doctors around. But you know, what we currently have right now before us that has had a public hearing, a bill to have Guam join the nurse licensure compact. And what this does is it not only opens up the window for nurses that are part of the compact states to come to Guam and practice on Guam, but it also frees up and makes it easier for military nurses, you know, wives of military people who are nurses who are stationed on Guam to practice on Guam without having to go through the arduous licensing and expensive licensing on Guam. It also opens us up for telehealth, and it also opens us up for more training for our nurses on Guam to get more training from nurses in licensure compact states. So I think that while we have a public health system and we have a hospital system that is available for people, I believe that the missing link to provide greater service to people would be the availability of nurses, especially specialty nurses. And I think that we need to pursue that avenue because, you know, short of having insurance, there is free public health, but it has to be adequately staffed, and especially with nurses because they're the starting point for access to care. Thank you.
Thank you. Speaker.
Thank you. Again, taping off from Senator Torres, I just want to say Bill 239 has been introduced since last year, and we still don't have the committee report yet. Working really hard to get that done. In the 27th Guam legislature, I introduced universal health care and got crucified for it, but I think that the times are changing and we need to revisit that. Third is I've been working with NACO, which is the National Association of Counties, and there's a program that they have that would assess a 4 cents per person charge. But if that goes through, we could ascertain maybe 40% discount on all prescriptions. And that's we're at the draft stages right now, and I think that could really help, especially because medication here on Guam is rising like you can't imagine. I remember back then I used to pay not even a couple of bucks for a prescription, and now just to get a prescription filled for 30 days cost me 3 times the amount. So that's something that I want to look at. And you know, I've always said what may not have been good back then is better today, or what may have been good back then is not good today. So I think it's about revisiting that, and universal healthcare has to be a part of that equation, because as a government, we need to make sure that we provide for the basic services, and of course, health is one of those key components. So I'm just very appreciative that I can continue to think outside of the box, look for solutions, and maybe we can, as colleagues, getting bipartisan support, you know, bring these solutions to the table. And the bipartisan support I had with Senator Mary Torres on Bill 239, we continue to write letters and ask for that committee report to come out, because working with getting this is an access to 2 million nurses and bringing better training to the nurse component. Because
thank you, Speaker. Thank you, Speaker. Sorry. Next question. Was that everybody?
Yes, it was.
Okay, thank you. Next question, conflict of interest. In the 35th Guam legislature, we've seen everything from sitting senators sitting in on public hearings with bills that would, benefit or otherwise impact businesses owned by their family members. We've seen, senators chime in on legislation about game rooms when it appeared they could be conflicted. We've had instances where senators have fought to give funding to organizations headed by their relatives. So, that being said, would you say that the 35th Guam legislature did a good enough job of dealing with conflicts of interest during their term? And we'll start with Speaker Barnes. You have 2 minutes to answer the question.
Thank you, Chris. Potential conflicts of interest and interest, those protocols are already in place right now. And as we look at issues that come in hand, we know that we, in our standing rules, have already provisions in place that's saying that if there are immediate family members or immediate relationships that happen within their businesses on RFPs going out or things, even in the legislature, we have a duty to report and acknowledge that, and even send letters to, of course, the presider that there is a potential conflict of interest. And I must say that I'm sure that my colleagues have been very, very upfront and forefront in making sure that those reports are provided. So as we have the protocols in place, potential conflicts of interest, I mean, everybody on Guam may be related in some way or another, but everybody in this legislature, we have that responsibility that we must report if there's any potential conflicts of interest. And time again, our colleagues have had to bring it up to the forefront, whether they're related immediate relatives or have some kind of connection in one way or another. So.
Thank you, Speaker. Senator Torres, you have 2 minutes to respond to the question starting now.
Thank you. I'm aware in past legislatures where other members also called out where they felt that there might be a potential conflict of interest. They've called out, especially when it comes to voting or to discussion on the floor. I know also that many times in the legislature, when it comes to voting, senators will recuse themselves and they'll move to recuse themselves, and then the body leaves it up to the body to either accept the motion or deny the motion. So those practices, in addition to the protocols that we have in our standing rules, very clearly outline conflicts of interest. I'm not aware necessarily of any particular instance where there was a conflict. I mean, other than with the vote on or discussion on insurance and the choice of insurance in the upcoming year, one senator recused himself because he is employed also with an insurance company, and that's the only one that I'm aware of right now. But I would say also we also have to consider that the legislature is extremely transparent in terms of all of their proceedings are live and recorded and available for review anytime on a YouTube channel. So in terms of participation and voting records and the comments, the transcripts, those all are there readily available either live or for anybody to reference. So in terms of transparency and all that, I believe that this legislature, more than any, is extremely transparent in that our day-to-day operations are live and on public record.
Thank you.
Thank you, Senator. Senator Shelton, 2 minutes to respond to the question starting now.
Thanks. I think you asked me the same question one of the last times I was on the show. And I am also aware, as the speaker said, of the laws that we have in place to protect our community and to protect ourselves as government officials. And the standard rules that we've put in place as a body that we all voted for to ensure that we have a transparent process free of any conflict of interest. And I've been very clear that if I were to have a conflict of interest based on my relationships with a business, with a family member, based on what the law provides, then I would certainly make the right decision to remove myself from the process. And that has not come up in the legislature at this time. And I've seen that we've had several times that some of our have removed themselves from a vote, and I will certainly do the same if it's deemed right for me.
Thank you.
Thank you, Senator.
Businesses have shut down. There's going to be a community rally. They plan on taking it to the doorsteps of the legislature tomorrow morning. We don't know if Congress is going to pass another aid package to help families. And the uncertainty of what's going to happen next year is frightening. We could see more businesses shut down. But there is a minimum wage increase scheduled for March 2020. If we're still in this sad shape, would you support legislation to repeal that minimum wage hike? And we'll start with you, Speaker Barnes.
I think it's important, Sabrina, that we have more discussion on this, because I think it's really important to know that based on the national standard alone, the minimum wage average is at over $15 an hour. Guam just increased it, and then there's another one. And I will share with you that even with businesses calling me and asking me what I can do to assist, I think as one who really wants to see the presentation on hand, hear what the economists have to say, and see how it will affect the impact. I think what we need to do is look at the minimum wage component, look at the living wage component, look at what the people have to do. It's about inafamalik, making good on what we as a community deserve to make as we go through our livelihood. And I think that in this effort, I think we need to come to the same table, because we are way below the standard of what is being done nationally. $15 is at the bare minimum right now, and we are still at $8.75. And the businesses need to come and to this table and work with us also, because there needs to be a fair share of how we move forward together. And when we do it together, we have that Malik spirit to move forward for our community. And we brought this up before. It's come up time and time again.
Thank you, Speaker Barnes. Senator Shelton?
Senator Shelton?
Thanks. As a co-sponsor of Public Law 35-38, which raised the minimum wage gradually over time, I'm in support of keeping this public law in place. However, I remain open to the discussion if there is a need or a call from the business community to put a pause or to put an extension to the law. Of course, I remain open to that discussion. However, I also realize that we increased the minimum wage gradually and in collaboration with the private sector, so that we could increase the dollars circulating in our economy. And I think to put a stop to this, to halt the increase of the minimum wage as it's scheduled in March, will stifle that kind of growth that we need at this time, to put more money into the pockets of our people, so that they can go out and be contributing members of the economy, and to put the dollars into the businesses that we need.
Thank you. Senator Torres?
I really think that our businesses, if they are going to survive, need every ounce of help. And a minimum wage increase, even though it's just an incremental increase in March, is not any help to the business community. So I would be in support of legislation that somehow throws a lifeline to businesses so that they can thrive. I think right now what we need more than anything is some breaks, for these businesses. We need to give them some relief. I mean, the idea that when you're out of money, you tax more is not going to happen right now in this COVID situation. No way, because we got to remember that we have our main engine that drives this economy, tourism, with no indication that it's going to come back to, anywhere near normal in the next 2 years. The military spending, we hope will offset some of that. But really the core of Guam is the small businesses. That's what keeps us the bread and butter of our economy. They are the bread and butter. So what I would advocate for is more relief to the businesses. What can we do to make it easier for them to keep their doors open? What can we do that would make it easier for them to maintain most of their employees? That's what we got to look at, not putting the nail in the coffin that's going to shut them down forever, with no hope of them coming back. I want to look at what we're going to be post-COVID, or at least post-vaccine. And that means we keep everybody hanging on the vine as best as we can and don't do anything to compromise them falling out of business. So I would not support it at this point.
Thank you, Senator. Next question actually comes from our Facebook Live feed. Aaron de Guzman writes in, ask these senators what letter grade they would give the 35th Guam legislature. And last time, Speaker and Senator Shelton, I don't believe you gave a grade when we asked to grade the administration. So this time, please give a letter grade for the 35th Guam legislature and explain why you gave that grade. And we'll go ahead and start with Speaker Barnes. 2 minutes.
I did give a letter grade to the administration at a B in the weekend work. And if we had to look at the legislature, there's always time for improvement. I would give the legislature a B. And I think because there's always room to improve. And as we continue to write policy to make our community better, I think it's finding solutions, especially with an invisible war that we're in right now. We've tried to work on solutions to help with the pandemic. Of course, depending on who you talk to, we've gotten crucified, but we should never give up. Here on our island, we're culturally connected and we're sensitive. It is in our nature to be respectful and give the hospitality. But I think what we need to do is, for this invisible war that we're going through, we don't have all the answers, and it needs a community to come together. I want to continue to work to see how we can work with them to get our nurses. I don't want to hear about the complaints. Is how do we get resources to our community? One bill is that nursing licensure compact that will help. I've worked with Taiwan, I've worked with CNMI, and I've worked with the Soccer Association to see how we can bring PPEs and medical needs to our community. So it takes an engagement of working with the community, working with the business stakeholders, working with the administration, and working with the legislature. So there's always room for improvement.
Thank you.
So
Speaker.
that's what I have to share, Chris and Sabrina.
Thank you. Senator Torres?
If I were to assign a letter grade, it would be either a pass or a fail. And in this instance, I would issue a pass to the legislature. We have to remember that even in these COVID times, this legislature, notwithstanding the fact that they have not met physically very often, they have conducted over 20 oversight hearings, public hearings, just oversight hearings and informational hearings on COVID alone. So you can't discount the fact that they've been as responsive as they could, even though we've been staying at home. Number one, there have been a great number of bills passed in the legislature. I think where I wouldn't assign a stellar grade to the legislature this term is I feel, in all honesty, I feel that there could be more camaraderie and communication. I feel that the committees could have worked better as committees instead of committees as one. There are many bills that are held up in committees that don't get reported out, don't get public hearings timely. And there's really not all that much communication when you're the person holding the bill, wanting it to get out. So I think that there can be a little bit more camaraderie. There can be a little bit more of nicety. I mean, we've got some people in there who aren't necessarily civil all the time, and that makes it very difficult, to work. This is my third term as a senator, and I came in at one point where mentorship was a big thing. Where people held hands and you were on a first name basis, and that's the way it was. So if it were like that, it would be an A, but right now it's a pass.
Thank you, Senator.
Senator Shelton.
Thanks. I'd probably be somewhere in the middle, a pass, and maybe a B. I guess what the speaker said as well, and I agree with both of my colleagues here that there's room for improvement. There's room for increased collaboration and collegiality, and I have to say that these two ladies have been some of my best mentors in the legislature, who have really been very supportive of some of my initiatives, and we've worked together very well. So this has been a good working relationship for us. But I think the legislature has done a lot, especially since the pandemic. We've been in session, I think, every month since we've been in this pandemic, and we've come into special session. We've been called to regular session and into emergency session, and we've been able to do things like pass the Azuda Mengafa Help for Families Act to give a $500 stimulus to families who were left out of the federal stimulus program. We were able to expand the Dave Santis Act to give small and micro businesses more tax relief, and to make that a retroactive relief to the beginning of the year and extend that to January 2022. So I think we have been hard at work, and there's still more to do and more that we can do.
Thank you, senators, for joining us. We now have reached the end of our program, so we'll give each of you 2 minutes to close, and we'll start with you, Senator Shelton.
Thank you very much, Chris and Sabrina and Jason and the KUAM team, for having us today and giving us this platform to talk to the people of Guam. Again, my name is Amanda Shelton, and it has been my greatest honor to serve you as your senator in this my first term of office in the 35th Guam legislature. And I asked for your continued vote of confidence to continue serving you, to provide opportunities for our families, to help us get back on the road to recovery and rebuild an even stronger island community for all. This term, I've been able to pass landmark legislation like improving our renewable energy standard to 100% to 2045. I've been able to work with my colleagues to strengthen the sex offender registry. I've been able to work to push more money to our institutions of learning to provide better technology and distance learning opportunities in the time of pandemic. I've introduced legislation to increase access to telemedicine and healthcare at the Guam Memorial Hospital. And this is work that I feel called to do to serve the people of Guam. And I ask for your vote. I'm number 6 on the Democrat side of the ballot, Amanda Shelton. Siduos Masi.
Thank you. Speaker Barnes.
Thank you, Sabrina. In closing, I just want to reflect on what the good Senator Mary Torres has mentioned, and it's about coming together. And as a community, as a legislature, just everybody in the Famalic spirit. And many choose to sit and complain while some of us do take the time to work really hard. And I just want to say, please, something my parents, Bill and Ann Munya, has shared with me, and even as an athlete, right? They taught me to be a team player. They taught me about loving, caring, and sharing. And when we come together, we become stronger. We become, we truly embrace the spirit of Famalic, and that's what I have to offer. I believe in fairness. I believe in parity. I believe that when we come together, we can have respect for each other even if we don't agree with each other, let us agree to disagree, but do it with respect. Respeto para todo. And that's what I bring to the table. I have a lot of hard work. I do a lot of hard work. I'm a great facilitator. I'm number 5 on the Democrat side, but each and every one of you have a very powerful gift, and that's your gift of vote. And please afford us the opportunity for one of your votes. And I say that because in the spirit of working with my 2 other colleagues in this Zoom, they have been very, very respectful and very willing to work collaboratively to bring the people's issues forward and to work with it with a lot of respect. And our work is not done. So please have the heart and consider all 3 of us on this Zoom today. Sainamasi, and God bless you again for always giving us the opportunity to be a part of the show and tell the people how we continue to work hard.
Thank you,
God
Speaker.
bless.
Thank you. Senator Mary Torres.
Thank you. I began the opening by talking about why I'm running again. I'm running because we need policies that rebuild Guam's families, that remove barriers to opportunity and restore dignity to our island. And that's why I've worked across the aisles to expand Guam's family leave laws. That's why I fought for fair chance employment practices, and why I'm challenging new licensing standards to improve Guam's access to health care. But there is more work to do. And this pandemic has shown that we are in dire need of diversifying our economy, of slowing the revolving door of crime, and increasing our access to health care. So if developing new industries and protecting our children and having better access to care matter to you, then please allow me to keep working for you. In the midst of this pandemic, Guam needs our families to be stronger, and we need policies that we know have a positive impact for all of us. Like many of you, I mentioned I've raised a family, and I worry every single day about the policies that we make that impact them. And my role in the government and the service that I offer goes back very far. Public service has always been something that I've been involved with, either in the government or in the private sector, having worked as the Deputy General Manager of the Visitors Bureau, as the Executive Manager of the airport, as the General Manager of the Port Authority, managing a private law firm for over 15 years, helping to build Guam Soccer on Guam, but mostly raising a family, and raising responsible people who also service you, the daughter that you'll see in the emergency room, the daughter that you'll see working for civil liberties. I humbly ask for your support, and I just want to continue to do good for you and be that good leader. Situs Maasi.
Thank you, Speaker Barnes, Senator Shelton, and Senator Mary Torres for joining us today. And best of luck to you. Please stay safe.
Wash your hands, and there's virtual Bucci in there if you guys want to take some for the staff on your way out.
Oh, great. Thanks.
That's my grandma's recipe. Okay.
Thank you. Good luck.
There you go. Speaker Barnes,
Thank you very much.
Senator Mary Torres, Senator Amanda Shelton there with our today's segment of the KUAM News Decision 2020. Good show today, Bree.
Good show. Just as a reminder, you guys can still go vote at the Guam Election Commission 9 a.m. to, is it 4? 4? Oh, but call them, make an appointment first, 477-9791. Masks are mandatory. Bring a blue or black pen, and of course, an ID. If you haven't registered to vote, you can register same day when you go there. But the last day to register is October 23rd, I believe.
Right.
But again, more information, gec.guam.gov.
Thank you. It's 10:12. Guys, this has been the Link of the Breeze, 93.9. Thank you again to Carrier, IT&E, the Thrive Coalition, and Calvo Enterprises. Good job, Bree.
Good job. We also have a trivia question.
Yeah, we'll close the show out. We'll get a winner on the other side here. So it's with our partners at Pepsi, they're doing this great